Assalamu alaikum. I'm Dr. Ejaz Mohiuddin and we will discuss carcinoma of the breast. Carcinoma of the breast. The incidence is breast cancer is the most common cause of death in middle-aged women in Western countries. The incidence increases as the population ages. Etiology. Many factors play a part. Number one is geographical factor, more common in Western countries, which accounts for 3 to 5% of all deaths in women. In developing countries, it is 1 to 3% deaths. Age, never before the age of 20 years, but it increases up to 20% in 90 years. Gender, less than 0.5% of patients are male. Genetic, it is most in women with a family history of breast cancer. Dietary factors, it is most in women who eat low diet in phytoestrogen. Intake of alcohol increases the incidence. Endocrine, more in nulliparous women or in women who do not breastfeed their children. Breastfeeding protects the woman from cancer breast. Child at an early age protect the women of carcinoma breast. Also, protection is late menarche or early menopause. In postmenopausal women, carcinoma breast is common in obese. Exogenous hormones, especially oral contraceptive pill and HRT, if taken over a long period, increases the risk of carcinoma breast. Previous radiation, exposure to radiation increases the risk of carcinoma breast. Spread, local spread, the tumor increases in size and invades other portion of the breast. It involves skin, pectoral muscles or chest wall. Lymphatic spread, it occurs primarily to the axillary and internal mammary lymph nodes. Involvement of supraclavicular or contralateral lymph nodes represent advanced stage. Blood spread, by blood it spreads skeletal metastasis. It involves the lumbar vertebrae, thoracic vertebrae, femur, ribs, skull. It also involves liver, lung, brain, adrenal gland and ovaries. Clinical presentation, any portion of the breast including the axillary tail may be involved. Most frequently found in upper outer quadrant. They present as a hard lump associated with indwelling of the nipple. As the disease advances, it involves skin and pudgy orange. Cancer and cruce or frank ulceration and fixation to the chest wall. 5% of patients present with metastatic symptoms. Investigations, chest X-ray, CT scan, chest and abdomen, isotope bone scan, CBC, lefty are needed for screening. Frequency of the cancer, number one, upper and outer quadrant 60%, upper and medial quadrant 12%, upper and medial quadrant 6%, lower and medial quadrant 6% and lower and outer quadrant 10%. Nipple area 12%. Management, achieve local control, surgery, widespread excision of the radiotherapy, mastectomy and radiotherapy, mastectomy, axillary lymphadenectomy and radiotherapy. These are different methods of management. If risk of systemic disease, chemotherapy and radiotherapy. Conservative breast cancer therapy surgery. Removing of tumor along the rim of the least 1 centimeter breast tissue is excised, which is called white local excision. Lumpectomy is referred to excision of benign tumor only, and no normal breast tissue is excised. Surgery, mastectomy, en bloc resection of whole breast, a large portion of skin with tumor including nipple, all fat, fascia and lymph nodes of axilla, sentinel node biopsy, hormone therapy. Tamoxifen has been widely used as hormonal treatment. It decreases the recurrence by 25%. Reference is Short Practice of Surgery by Bell and Love, edition 26. Thank you.